Welcome to our presentation, Redlining and Asthma. My name is Fahd, and on behalf of our group, which includes Debbie, Diane, and Deryk, I'm excited to start today's presentation. We'll begin with a brief background, followed by motivation plus context, and a discussion regarding where we are with the status quo. We will then present alternative solutions, and then finally discuss our recommendation. The idea of what we refer to as redlining has its origins to the 1930s. As America was coming out of the Great Depression, the New Deal federal stimulus program created an entity called the Homeowners Loan Corporation under the Federal Housing Administration. The idea was to provide opportunities for home mortgage repayment options with low interest rates to increase home ownership. Neighborhoods in major American cities were scored based on criteria that included housing conditions, surrounding areas, as well as racial and ethnic composition. It was graded as A as best or green, B as still desirable or blue, C as definitely declining or yellow, and D as in hazardous or red. As you can see on the map on the right, within the city of Oakland, West Oakland is the primary area of red neighborhoods, while the green areas correspond to the wealthy Oakland Hills region. These maps were also adopted by private banks and mortgage companies. When we look at the historical implications of redlinings, it plays a significant role in the current composition and disparities of those same Oakland neighborhoods today. This data is from 2020. When compared across median household income, owner-occupied housing, and percent with a bachelor's degree, redline neighborhoods fare worse in all those measures. And when looking at racial composition, 94% of the current day redline neighborhoods are non-white, while only 1% of green neighborhood residents are non-white. It's quite startling to realize that almost 100 years later, redlining continues to have a strong racial and socioeconomic effect.
The legacy of redlining, racism, bias, a fracturing community, us versus them, goes beyond financial impacts that can be seen in the health outcomes, most worrisome, negatively affecting children, Oakland's next generation, the future. Herein lies our sincere motivation to further delve into understanding and combating increased asthma rates in historically redlined areas. These maps, published in 2021, display the difference in new asthma cases in 8 children aged 0 to 17 due to air pollution between the historically redlined West downtown Oakland, approximately 70% Black, Indigenous, and people of color, and Oakland Heights, approximately 70% white. The contrast is heartbreaking. With a separation of only 4 miles, 1 in 2 new cases of asthma in children in historically redlined neighborhoods is from air pollution, while only 1 in 5 new asthma cases in the majority white neighborhood are caused by air pollution. 4 miles. 4 miles between relatively clean air and air that causes physical harm. As a group, we find this stretch to be unfathomably disparity. Stepping back beyond the borders of Oakland, even further still at the state level, the residents of Oakland are suffering at a rate significantly higher than that of neighboring cities, the county average, and the state average. Exploring our graphic, in 2017 to 2018, 5.5% of Oakland children are more likely to be diagnosed with asthma as compared to Piedmont, an affluent city encapsulated within Oakland's borders. Within Alameda County, the percentage of children diagnosed with asthma in Oakland was approximately within the medium range. But at the state level, Oakland ranks as one of the worst cities in California for child asthma diagnosis. But there is hope. With current initiatives and grassroots programs, the percent of childhood asthma diagnosis is decreasing. Yet, in context, and in parallel to the decrease in youth percentage, overall asthma-related emergency room visits increased. This furthers our group's motivation to continue aggressively pursuing policy alternatives that build on current work and address this problem with the care, thoughtfulness, and urgency it deserves.
Why focus on redline neighborhoods? Well, the map on the right shows the census tracts in cities of San Francisco and Oakland categorized according to their homeowners loan corporation grade. Now the map on the far right shows asthma-related emergency room visits per 10,000 residents for the same census tract neighborhoods. As you can see, the purple portion of the map on the far right shows the rate of asthma-related room emergency visits for those same census tracts. As previously stated, historically redlined neighborhoods since the 1930s has led to structural racism in housing and led to negative health outcomes. Although Oakland community organizations and Alameda County government has demonstrated a high level of commitment to resolving these disparities, the inequities remain. Seeing the stark visuals representation of the impact of racist housing policies on important health outcomes motivated us to focus on what we might address this injustice.
Based on the background and research presented thus far about the relationship between poor asthma outcomes and historical redlining in Oakland, we define the core policy problem as this. Residents of historically redlined neighborhoods in Oakland have higher rates of asthma-related emergency department visits than those living in non-redlined neighborhoods. The remainder of our presentation will describe our evaluation of several policy alternatives that aim to address this problem by improving asthma outcomes and combating the persistent inequities caused by redlining. To address this problem of unequal asthma outcomes caused by historically racist housing policy in Oakland, we've developed 3 policy interventions that target determinants of health at different ecological levels. Alternative 1, enhanced care coordination for people with severe asthma, is targeted downstream at improving individuals' health through education and improved healthcare. Moving upstream to living conditions, Alternative 2 uses housing assessments and interventions to improve unhealthy home environments that can lead to worsening asthma. Traveling further upstream to general environmental conditions, Alternative 3 improves outdoor air quality by expanding the Owning Our Air program. In the following slides, we will explore the status quo and each of these alternatives in more depth.
We'd like to familiarize our audience with the current meaningful and impactful work of our partner NGOs and their unique approaches to helping Oakland residents combat asthma triggers and curtail asthma-related emergency room visits. Community-driven and mission-focused, we recognize Asthma Start's sharing of strategies to reduce school absences, emergency room visits, and hospitalization in asthmatic children aged birth to 18. The Owning Air Project, advocating for a less polluted city, and Alameda County's Department of Healthy Homes grants for improvements and equipment necessary to reduce asthma triggers in the home. Although we do not address school-based clinics, we recognize the work of La Raza school-based health centers as their work synchronizes with the following proposed expansions to Asthma Start. We are indebted to the entities working towards Oakland's healthier future, and the following policy alternatives seek to build off the consequential work of our partner organizations and further address the increased emergency room visits for asthma-related emergencies in historically redlined areas.
The Alameda County Public Health Department's Asthma Start program provides short-term in-home case management services for children diagnosed with asthma. Asthma Start services include asthma education for families, remote home inspections to identify environmental triggers, collaboration with healthcare providers and schools, and smoking cessation referrals as needed. Multiple studies demonstrate the effectiveness of in-home case management for improving outcomes and reducing healthcare costs of children with poorly controlled asthma. A representative of the Asthma Start program itself reports that ED visit rates for enrolled children dropped from 65% during the year prior to enrollment to 13% after program participation, and hospitalizations dropped from 45% to 4%. To build on the impressive results of the Asthma Start program, this policy will expand eligibility to all age groups. Since we know that asthma rates among adults in Oakland are nearly as high as those for children, our proposed expansion has the potential to nearly double program impact. In order to benefit a higher proportion of affected asthmatics, we will intensify enrollment efforts for individuals who have had an ED visit for asthma and add broad community outreach in neighborhoods where severe asthma rates are highest. We will extend the program duration to 1 year or longer, with visits every 1 to 2 months as needed during that period, in order to ensure that education and care coordination efforts have lasting impact. Unsurprisingly, substantial funding will be required to meet the clinical, administrative, and outreach needs of the expanded program.
Our second alternative looks specifically at implementing an in-person housing assessment along with housing interventions. This is loosely based on how urban cities have previously dealt with the lead paint in housing. The idea is to have patients from red-lined neighborhoods referred to a case manager by an emergency department or urgent care after an asthma exacerbation. The case manager then coordinates an initial visit as well as follow-up visits to patients' homes, investigating potential asthma triggers. Not only are those triggers identified, but the program also pays for an intervention. Those interventions include pest control and storage solutions for cockroaches and mice, for example, allergen-proofing mattresses and pillowcases, as well as HEPA filter vacuum cleaners for dust mites, instructions to keep furry pets out of bedrooms, fixing water leaks, scrubbing or replacing moldy tiles and/or carpet, purchasing of cleaning supplies that do not exacerbate asthma attacks, referral to tobacco cessation programs, and purchasing of portable air filters. Currently, Alameda County does have a program called Asthma Start, as mentioned, but these visits are remote and not in person, and there is advice given, but there's not necessarily any funding for interventions. In New York City, there's an in-person home assessment with recommendations only. There's excellent published literature available, one of which was published in the New England Journal of Medicine, which evaluated randomized trial across 8 urban cities, demonstrating a significant decrease in asthma-related morbidity for those with comprehensive home interventions. 2 studies also came out of Boston, one of which focused on public housing and came to a similar conclusion that environmental interventions are very effective.
Our last alternative focuses on improving environmental conditions throughout Oakland. The Owning Our Air project is a joint effort between Bay Area Quality Management District and the West Oakland Environmental Indicators Project. The overall goal of this project is to protect and improve community health by eliminating disparities in exposure to local air pollution. As part of our efforts to expand on this project, we would like to increase the overall funding for these initiatives and support the project to achieve its goal, while also simultaneously eliminating disparities for historically redlined neighborhoods. With that being said, we'd ask for additional funding to support projects such as urban green strategies. Studies have shown that increased planting of trees will naturally improve the air quality by filtering pollution out of the air. According to an article from the Elsevier Journal, urban tree planting has been shown to reduce harmful particle matter such as nitrogen dioxide and ozone particles from the air. The intervention would not only improve redline neighborhoods, but improve the overall air quality throughout Oakland, which in turn will reduce the rates of asthma, since poor outdoor air quality has been linked to the development of the disease. The WHO suggests residents living in urban areas that about 80% of these individuals inhale air pollutions that exceed normal limits. Now that we've talked about improving outdoor air quality, let's focus our attention on improving indoor air quality. Implementing filtration systems within schools and housing units will greatly decrease the development of asthma. On average, 3 billion people are exposed to high levels of air pollutions, which include kerosene fuels, coal from cooking, and utilization of heating systems in the homes and biomass. With additional funding, we would be able to implement filtration systems throughout these spaces to improve the overall air quality. The additional funds we receive will go towards projects within the pipeline to achieve less than 0.13 diesel particle matter in the air by 2030. Although the results will not be immediate, working towards permanent solutions will enable the city of Oakland to close the gap between poor environmental conditions and the negative health outcomes for residents of Oakland as a whole. Based on our policy alternatives, we have chosen 4 evaluation criterions: equity, effectiveness, safety, and policy sustainability. Collectively, we believe equity was a missing component for these redline neighborhoods and felt our interventions would improve conditions of these neighborhoods, thus reducing the gap rates of asthma-related ED visits between redline neighborhoods and non-redline communities. Although there are pre-existing policies to improve asthma, Oakland remains to have one of the highest asthma-related ED visits in Alameda County, which is why we decided to include effectiveness in our criterion to ensure our policies will reduce asthma-related ED visits drastically. Because poor air quality and lack of effective asthma treatment represent unsafe conditions for affected individuals, we felt it was important to measure how well each alternative would address safety. With our proposed alternatives, we hope to achieve policy sustainability that will allow the city of Oakland to carry on these initiatives and achieve the long-term solutions that will eliminate the disparities that have negatively impacted redline neighborhoods. These are the projected outcomes we hope our policy alternatives will achieve. Collectively, we decided the percentages of each criterion and gave percentage value based on what we thought would be more important to address. We decided to give the highest percentage to the equity criterion because we believe equity is the most important of our goals for this policy. We rated effectiveness at 25 and safety at 20. We rated policy sustainability at 20% because there is too much uncertainty in the current funding environment to make accurate projections about sustainability. On the top left corner, you will see the key with the point system we developed. 1 equals a low impact, 2 medium impact, and 3 high impact. The red boxes were given a 1 for low impact, yellow box a 2 for medium impact, and green boxes 3 for a high impact. We multiplied the impact scored by the criterion weight of each outcome and summed across outcomes a weight total score for each policy alternative. The housing environmental policy alternative received the highest score and status quo ranked the lowest. The next slide will discuss the trade-offs for each policy alternative.
As you saw in the prior slide, these policy alternatives vary in their anticipated outcomes across our criteria, with the status quo ranking lowest and housing environmental interventions ranking the highest. Reviewing our alternatives more qualitatively, we can see that high costs are the biggest barrier for all 3 of our proposals. Expansion of the Owning Our Air project trades potentially high long-term impact for significant short-term challenges to achieving meaningful outdoor air quality improvement, in part because state and federal level interventions that are out of the scope of this proposal would be required to maximize effectiveness. We see that both the care coordination and the housing interventions are strong evidence-based policy options that should improve asthma outcomes for their participants. Of the proposed policies, only the housing environmental intervention in its direct targeting of redlined neighborhoods offers a direct way to reach our primary equity goal of reversing the effects of historic discriminatory housing practices in Oakland.
In full consideration of our problem statement, projecting alternative outcomes and confronting trade-offs, we recommend the expansion of Alameda County's Healthy Home program to bolster housing assessments and environmental interventions. Turning our attention to why housing in white, we highlight a 2021 statistic provided by Indoor Air Quality that affirmed our decision that Americans, on average, spend 90% of their time indoors, and that concentrations of pollutants are often 2 to 5 times higher than typical outdoor concentrations. Referencing our projecting outcomes, we saw that addressing housing ranked high for effectiveness and safety, as exposure time and asthma exacerbations are, in context, highest in the home. But the question remained, does installing HEPA filters and other home interventions address the legacy of redlining, decrease emergency room visits for asthma-related emergencies, and serve those who currently live in these historically redlined areas? How do we ensure that residents of yellow and blue areas, not just red, fully benefit from our recommendation? Our recommended expansion of Alameda County's Healthy Home program with the addition of case managers opens a new level of equity of access for all residents of historically redlined areas, with experts in the processes and policies guiding families through the steps necessary to secure and ensure the health of their home, setting the criteria bar for equity. Of course, our recommendation does not exist in a fiscal or a political vacuum. Funding for bureaucratic complexity, political willingness to implement are key components of our recommendation. We hold that establishing a case management pilot program limited to historically red and yellow Hulk neighborhoods would establish true costs, fine-tune processes, and garner public support as ED visits decline. In this time of financial uncertainty, we accept that establishing funding may be difficult, but with aggressive lobbying by citizens and concerned parties, we hold the importance of addressing higher asthma rates related to emergency room department visits in redline neighborhoods versus those living in non-redline neighborhoods is a struggle worth waging. On behalf of our group, we would like to sincerely and genuinely thank the audience for their attention and their incredible work and acts of humanism on the behalf of the people of Oakland and Alameda County. We hope to join you in this noble effort to benefit all the residents of Oakland while implicitly improving asthma outcomes in historically redlined areas. Through unification and equity, we stand together in the absolute rebuke of the history of redlining. In this spirit of hope, we would like to conclude with a quote by civil rights activist and powerful humanist Maya Angelou. "As long as you are breathing, it is never too late to do some good." Thank you.